In the United States, health officials have recently confirmed the first known human case of the New World screwworm, a dangerous parasite that has long threatened livestock. The patient, who lives in Maryland, had recently traveled to El Salvador before the infection was detected. The U.S. Centers for Disease Control and Prevention confirmed the case on August 4th, describing the infestation as extremely painful. The New World screwworm is not new to science. In fact, this flesh-eating parasite has been known for decades. The female fly lays its eggs on warm-blooded animals, most often cattle. When the larvae hatch, they burrow into the flesh of the host, feeding from the inside out. While they rarely infect humans, when they do, the result can be both horrific and very painful. Medical experts explain that the larvae can be seen or even felt around wounds, and sometimes around the nose, mouth, or eyes. Infected patients require medical treatment, often involving surgical removal of the larvae. Although the infection is not usually fatal, untreated cases can lead to severe complications. The U.S. Department of Health and Human Services emphasized that the risk to the general public remains low. Officials note that this is the first travel-associated case of New World screwworm in a human detected in the U.S. for farmers and ranchers. However, this parasite represents a major concern. Colin Woodall, the CEO of the National Cattlemen's Beef Association, described the screwworm as a horrific parasite that can devastate cattle herds. The larvae literally bore into the animals, slowly destroying them from within. The U.S. Department of Agriculture has already announced new measures to counter this threat. One key strategy is the release of sterile male screwworms into the wild. Since female screwworms typically mate only once in their lifetime, this technique can drastically reduce the population. It's a method the U.S. successfully used in the 1960s, when the parasite last posed a nationwide threat. Officials say this effort is part of a broader 5-part plan announced earlier this summer to protect both livestock and human health. While this single case in Maryland has raised concerns, experts stress that the situation is under control and effective treatments exist. Still, the reappearance of the screwworm serves as a reminder of how quickly parasites can spread, and how important vigilance is in public health and agriculture alike.